75% of all health records are carried via a PDF or a digital fax. Tens of millions of pages of health records every day. We have to get that data off of there. Either somebody has to type it into a record, or we use things like natural language processing to extract the data.
Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster with my guest today, Chris Larkin, the CTO at Concord. Chris, great to meet you.
Yeah, thank you. Yeah.
So I want to talk to you. You're not our typical guest, because we often talk to founders of early stage startups.
Right.
You're the CTO of Concord, which works in cloud, fax, and works at a very advanced level in terms of the amount of data that you process.
That's right.
Yeah.
Yeah.
So, but I did want to have you in the chair to talk about how early stage startups can interface with larger companies when it comes to things like cloud fax and interoperable data.
Right.
Maybe you could start by telling me a little bit of your background and how you came to Concord.
Yeah, sure. Very good. Came to Concord because my background is in AI, artificial intelligence, and healthcare data. I did it for big companies like Microsoft and GE before I came to Concord. The thing that brought me to Concord was the understanding of this amazing river of data that goes from one provider to another provider. In other words, from a clinic to a hospital, to a hospital to a clinic, to the tune of tens of millions of pages of health records every day.
And you say pages because they're faxed.
Yeah, that's right. So that's the way we count. And so, for example, we manage about 15 million pages a day of healthcare records flowing through our system. Now, what does that really mean? Well, those pages carry data. So from a healthcare startup standpoint, what we need to understand is about 75% of all health records delivered into a provider today are carried via a PDF or a digital fax. Well, then we have to get that data off of there. Either somebody has to type it into a record, or we use things like natural language processing to extract the data. And once you extract the data, you free the data. So now we've got a lot of data. So it's fishing in that river of data that I talked about that is so intriguing, whether you're a startup or whether you're a older stage company like ours. The key is that when you free the data, now what can you glean from it?
Yeah.
And so,
what are you seeing as interesting opportunities for potential early stage startups, just startups in general,
Right.
when it comes to fishing in that stream of data?
Yeah.
I'm sure you're sort of unlocking it,
Right.
and you're probably seeing opportunities along the way.
Right. So as we unlock it, we're looking for partners who can create interesting algorithms that say, I understand that the customer is in behavioral health. We have just found the word lithium in the first 2 pages of this inbound record. And lithium is a mood stabilizer in health, in treatment of behavioral health situations. And that means, hey, I'm going to accept that patient because they're already on a mood stabilizer. So it's being able to drive into the records and as quickly as possible create insight into that record. Why? Because a process like intake, in other words, intaking a patient into the hospital can take hours upon hours.
Yeah.
You may be familiar with the problems of an emergency room. What if we've already structured a lot of the decision making and rules associated with that so that hours become minutes, so that the wait time in places like emergency rooms or intake centers for hospitals are already done, and all we need is the patient's data to come in, and we're going to either accept that patient or send them down the road to another clinic that can really help them.
Okay.
So it's that interaction. It's being able to move quickly, use algorithms to find that insight as quickly as possible in those health records.
And you see that coming out of sort of innovative smaller groups that understand a niche problem and create very specialized algorithms out of a knowledge of that problem.
Yes, I'll give you another example. As these health records move around, one of the problems that startups can have is showing what they could do rather than what they should do, which is a line out of Jurassic Park from Dr. Ian Malcolm. But the reason why that's so important is because most companies like mine and most healthcare providers hear AI all day long, all week long, from everybody. So there's a cacophony out there, a lot of noise about AI. But if you can focus on reducing costs of the provider, if you can focus on saving that physician 2 minutes of time every time they touch a health record, then you're actually improving their life, the physician's life, the administrator's lives. So as a startup in healthcare, really focusing on, okay, we've got an algorithm, for example, or we've got a new system that provides a platform of algorithms. Focus on a practical problem to solve.
I like that.
Cost, scheduling, timeliness, taking fingers off of keyboards, because that costs time in the system and slows the patient down.
Okay, so that's you've identified an opportunity there.
Yeah.
Now I want to ask you, you've had a chance to sort of see these trends emerge in your work. What are some red flags for folks that are maybe jumping into the industry who don't, without the knowledge that they need to really plug into that stream of data? Because you've got people sort of saying AI, like you said, kind of using the right buzzwords, but can they really plug in a helpful way? Well, what do you see as the red flags?
Yeah, I'll tell you, I'll give you a story about a problem that happened to me when I was showing my software that I created about 25 years ago. It was I was simulating a year in the life of a clinic and doing patient flow algorithms. So how many patients are coming in, how are they treated, how are they flowing through the hospital. So simulating a year in the life. The problem was when I presented to a room full of nurses, managing nurses, and doctors, is I had lots of brilliant flashing lights on how fast patients could come in. I didn't have a picture of a human being anywhere on that slide. And so they basically kicked me out and they said, when you learn that healthcare is about people and about helping people and showing people being helped, we'll have our next conversation. So I never lost that particular lesson.
No question. So, it's more than just the images of people. It's also probably incorporating real human actions into the technology. So what's that side of it?
Yeah. So again, showing what an algorithm or showing what your AI can do is only half the story. Have you integrated the interaction between the AI and the human? Have you really designed and thought about leveraging the intuitiveness of the physician together with the rules and the results of an algorithm? Because I don't want a robot doing practicing medicine on me. I want a real doctor with that intuition and skill and experience.
Okay. So we're not talking about humanizing AI. We're talking about making sure that we're augmenting humans with AI.
Augmented intelligence. That's what it's about. So showing your system in relation to and well designed with the physician in mind, or with the nurse in mind, or whomever the administrator who's ever going to use it, is really important. That way, they don't look at your system and say, oh, I see, you're going to replace me. No, we're going to augment me.
It's like if you're to have a slide deck and you have all these sort of attributes, kind of what's in the center of your image? Is it a doctor with all these things sort of plugging into them? Is it a patient with all these things helping them? Or is it the AI at the center?
That's right. And a real easy metaphor is what we did with avionics and the pilot. Right? We didn't replace the pilot. I wouldn't have flown here without a pilot in the cockpit. So what we did is we created, with the thousands of sensors on a plane now and all the avionics and analytics, we said, okay, there's going to be a pilot there, and he's going to need to understand what all this means at any 1 minute. So we designed a person in the loop, a pilot in the loop. That's the way to think about the physician or the clinician, with a person in the loop. Design that way, and you'll get a lot more acceptance when you bring your product to market.
Now, this is a whole different conversation, but to be fair, we did shift the job of the pilot to such a degree that the quality of their work, maybe the enjoyment of flying, has changed, and so there will be a future for physicians that we have to wrestle with.
That's right. And what we hope that is that we take them out of the administrivia and we let them practice at the, and this is a saying, at the top of their license. In other words, let them be used for their highest and best use, which is listening, using
Human
their
to
intuition,
human.
human to human contact.
Yeah.
Because they can listen for things that a robot cannot.
Yeah.
So,
Well, I hope that's the case. I
do
appreciate you
too.
stopping into the
Yeah.
studio.
It's great.
Appreciate your advice, and I'll be watching Concord and your developments next year.
Outstanding.
All right,
Thank
thanks.
you. All right.
Take care.